Well, the Affordable Care Act was signed into law more than 4 years ago. The centerpiece of it is the health insurance marketplace.
And in it, there's only one health plan created by physicians.
Yeah, and two of them, they're here today. We're pleased to welcome Dr. Robert Falk and Dr. David Allen. Good to see you guys
Welcome
this
back.
morning. Yeah.
Good morning.
Yeah, thanks for coming back. So what exactly is the Midwest Independent Physician Practice Association? Who's involved? What's the history of this thing?
Well, the Mippa was originally started by a group of independent physicians about 5 years ago that realized we really didn't have a voice for us. There was a large organization, we all know Allegiant, now CHI, the university or Methodist, and those organizations were working to build up for the long term, and we kind of were left out a little bit. So we needed an organization with a voice for independent doctors, and that's how we came into being.
And there are hundreds of you involved in Mippa.
700 members in Mippa,
Yeah.
which is which would rival the size of any of the other organizations.
And where are these physicians from? What? Not just in Nebraska, though? Or
There are a few in Iowa. The vast majority are right here in Omaha.
in Omaha, yeah.
Yeah, so explain the health plan to us. Just listen, this whole Affordable Care Act still confuses me, and I've done my best to understand it. But why did you create this, and what's the value to families like mine?
Sure.
Well, I think the value to families like you is that this is a physician-directed and physician-led program that was developed in concert with Coventry. And so as physicians, we're on the front lines and we interact with the patients on a daily basis. We hear their concerns, we hear their problems, their stresses, we feel those. Our goal is to carry those into our product to alleviate those concerns, problems, and issues. So some of our goals have been, one of the things we constantly hear is patients want freedom of choice. So this network has over 1,100 physicians and mid-level practitioners within it. People want the opportunity to be able to go to a specialist without having to go through a referral and jump through 3 hoops to do that. This plan allows for this. And I think most importantly, as Dr. Allen was saying, is that patients in this plan have the assurance that the doctor is working for them and is free of the constraints of a more traditional system that we've become used to in the past decade or two, of a business management-led system versus a physician-led system. So we have, as physicians in the program, the complete autonomy to do what's best for our patients without the constraints of a traditionally led business management program.
Yeah, it's one thing to see that need out there, but it's another to take it a step further and develop this plan. So what was that process like, you know, kind of narrowing down the scope of what this plan involves?
Right. Well, initially when we started talking about this, this organization came to be, and we realized all the resources we had and things with these new plans, this healthcare exchange that's being rolled out. A lot of people have high deductibles. You know, we see as physicians very high bills come in. People are like, look at this CAT scan for $2,500, for $3,000. And we really, as independent doctors, know that, and everybody knows that there are some things, some tricks, or maybe not tricks, but some things we can do to help save people money. An outpatient CAT scan costs $600 or $700, whereas an inpatient CAT scan costs $2,500. And as an independent doctor, we can look at the patient, at the plans, figure out where the best place to send the patient is to save the most money, and I think that's going to be huge for people.
On the screen now, you see a website. It's MidwestIPPA.com, and we'll link back to it from our website as well. But is that where we sign up for the plan, or do we go to another website and then look for Mippa? What do you recommend?
The easiest way to do it is to go to the MidwestIPPA.com website, and you will see a tab there which says Enroll Now. If you click on Enroll Now, that will take you to the link to see the Coventry Health Plan sponsored by Mippa. It will go through all the details with you. Then gives you a place to answer questions, ask questions if you do have them, and you can actually enroll right from there. I think that's the simplest, easiest way.
Yeah, we need to do an hour show on this, really. There's so much information out there, but in a nutshell, and I know you touched on this, but before we wrap up, why is this different than other plans that are out there? What makes this so unique? I know it's driven by physicians, but...
Well, to me, the main thing is, again, as your provider or your doctor in this situation is uniquely positioned to help you save money. And so even the plans, when you go to the exchange, there may be a plus or minus a couple of dollars. But really, when you have this plan, your doctor is going to know that have the ability to get things done in a more economical, or motivation as well to get things done in a more economical way for you.
You've got a couple of months here to sign up. February 15th will be the deadline. And again, the website is MidwestIPPA.com, and local. Here at the Morning Blend, we love local, so you see it on the screen. Even the mailing address is in Omaha, and the number, in case you'd rather call with questions rather than log on, please jot that down or watch this clip again to get it.
Really unique. Yeah, I like this.
We appreciate you being here
Thank you.
today.
Thank you.
Thank you.